Hi everyone, this presentation is by Sarah, Carly, Alex, Gerline, Jacqueline, and Andy. The topic is trauma and stress-related disorders, specifically post-traumatic stress disorder or PTSD. With a topic like PTSD, there are many important things to look at. As an overview, today's presentation will cover a little bit of background on PTSD, the characteristics and symptoms that occur with this psychiatric disorder, the causes, the therapy, treatment and interventions, as well as an example of how PTSD is portrayed in today's society. So why is this mental disorder significant? Post-traumatic stress disorder can happen to anyone of any culture or ethnicity at any age. Exposure to a terrifying or upsetting traumatic event can cause PTSD, and this exposure can occur directly or indirectly. PTSD is a psychiatric disorder that can develop in people who have witnessed or experienced a traumatic or terrifying event, such as war, natural disaster, personal assault or attack, or a serious accident. Women are twice as likely to develop it than men. People who suffer from this mental disorder have profound, unsettling thoughts and feelings related to the traumatic experience long after the event has happened. Studies suggest that prevalence rate of lifetime PTSD in Canada is estimated to be 9.2%, with more than 75% of the respondents reporting that they have been exposed to or have experienced at least one traumatic event in their lifetime. Now looking at characteristics and symptoms. A PTSD diagnosis is based off of symptoms presented by the American Psychiatric Association's DSM-5 for PTSD. The PTSD checklist, also known as PCL5, is a self-test based off of 20 questions, which can give a provisional PTSD diagnosis. However, the clinician-administered PTSD scale, or CAPS, is considered the gold standard for diagnosis. Both the PCL5 and CAPS are based off of the symptoms criteria outlined by the DSM-5 for PTSD. The DSM-5 presents 6 categories of symptoms of PTSD, which are listed in the present and following slide. Each and every symptom is not required for a PTSD diagnosis. However, at least one symptom in each category, which has lasted for at least 1 month, is required. Signs and symptoms differ from person to person and are also impacted based off of the traumatic event which induced their PTSD. The following symptoms are included in the intrusion or re-experiencing category: intrusive thoughts or memories, nightmares related to the traumatic event, flashbacks and feelings like the event is happening again, and psychological and physical reactivity to reminders of the traumatic event, such as an anniversary. In the avoidance category, there is avoiding thoughts or feelings connected to the traumatic event, as well as avoiding people or situations connected to the traumatic event. In the dissociation category, there is depersonalization or feeling disconnected from oneself, and derealization, which is a sense that one's surroundings aren't real. In the category of negative alterations in mood or cognition, there is memory problems that are exclusive to the event, negative thoughts or beliefs about oneself or the world, a distorted sense of blame for oneself or others related to the event, being stuck in severe emotions related to the trauma, severely reduced interest in pre-trauma activities, and feeling detached, isolated, or disconnected from other people. In the category of increased arousal, there are symptoms of difficulty concentrating, irritability or increased temper, difficulty falling or staying asleep, hypervigilance, and being easily startled. The duration of these symptoms must last for at least a month in order for a PTSD diagnosis to be made. The effect on the person must also be solely due to the traumatic event and not the use of any medications, drugs, or alcohol in order to meet the requirements presented in the DSM-5. It is clear from these symptoms how experiencing PTSD can have a significant negative effect on one's ability to function in day-to-day life and maintain relationships, work, and mental health. In terms of the causes of PTSD, PTSD is a type of anxiety disorder which can develop after someone has experienced a traumatic event which involved the threat or injury of a person. These traumatic experiences are commonly associated with, but not limited to, motor vehicle crashes, natural disasters, physical or psychological abuse, physical assault or injury, sexual assault, rape, and war. The DSM-5 diagnostic criteria states that the traumatic event must have exposed a person to actual or threatened death, serious injury, or sexual violence. The individual must have directly experienced the traumatic event, witnessed the traumatic event in person, learns of the event occurring to a close family member or friend, or experience first-hand repeated exposure to adverse details of the event. In other words, watching the event on one's phone or television, or indirectly learning of the event do not meet the DSM-5's requirements for a cause of PTSD. Cognitive behavioral therapies are the most common and efficient form of non-medical therapy or treatment for patients suffering from PTSD. There are many different types of methods of cognitive behavioral therapy, but for the purpose of this presentation, we will only be focusing on the following three: stress inoculation, prolonged exposure, and cognitive processing therapy. So, stress inoculation training was the first type of cognitive brain therapy that was designed specifically for patients with PTSD. This therapy is broken into three phases. Psychoeducation is where the therapist will educate the patient on the root of their stress. The patient will identify where the stress is coming from and why it is occurring. In this phase, they will also target each of the individual channels of fear. These channels include emotional, behavioral, physical, and cognitive channels. This stage is important as it is very common for individuals suffering from PTSD to subconsciously make the stress worse than it actually is through their thoughts and coping strategies. This phase will help the individual regain focus on the actual stressor itself. The second phase is skill acquisition. In this phase, the therapist will teach the patient the necessary skills required to overcome the stressors. These skills must be individualized and specific to the patient's scenario. This stage could also involve breathing techniques, emotional regulations, and problem solving. It is important for the patient to rehearse these skills with the therapist to ensure that they are doing them correctly. The third stage is implementation of acquired skills into everyday life. When the individual feels the stressors or the anxiety coming on, they can use the techniques learned in the therapy to regain calmness and eliminate anxieties. Cognitive processing therapy is a type of therapy that is based off of the information processing theory and the social cognitive theory. The therapy aims to identify any inaccurate thoughts that the patient may have regarding the traumatic event. These inaccurate thoughts may be the reason that they are not progressing in their recovery and are referred to as stuck points. Examples of these thoughts could be, I was raped because I was walking alone at night, or I can no longer trust any men because of what happened. Once these stuck points have been identified, the therapist and the patient will work together through a process called collaborative empiricism. Collaborative empiricism allows for the goals of the therapy to be determined by the patient with the assistance of the therapist. It is a method that allows for information to be obtained and gathered by both the therapist and the patient. The patient and the therapist will work through the stuck points to find alternative thoughts that relieve stress and promote recovery. And the last type of treatment that we will talk about is prolonged exposure therapy, which is based off of the theory of emotional processing. This theory suggests that pathological fear is embedded in our memory after a traumatic event takes place. The fear is very easily activated when individuals experience different cues or signs that remind them of the traumatic event. Prolonged exposure theory's main method is to activate the fear response using the cues and signals of the traumatic event, but in a safe environment for the individual to experience the fear. This allows for the patient to retrain the brain to identify that they are safe and incorporate corrective behaviors when faced with these cues and signals, ultimately eliminating the fear response. The intervention usually consists of 9 to 12 sessions that are 90 minutes each. There are two types of exposure therapy. In vivo is the first type, which is a gradual confrontation of the fear stimuli outside of the therapy session. Imaginal exposure is where the patient closes their eyes and they imagine the details of the events and talk through them with the therapist. The therapist will record the session so they can be used later. In order for this therapy to be successful, it is important for the patient to engage in the in vivo exposure or listen to the recorded tapes from the imaginal exposure on a regular basis. The therapist will also incorporate breathing techniques and meditation to deal with the fear response should it occur outside of the sessions. Exposure therapy is quite effective, as seen in a pilot study done for post-traumatic stress disorder delivered via telehealth technology. For starters, telehealth technology is the use of electronic information and telecommunication technologies to support long-distance clinical health care, patient and professional health-related education, public health, and health administration, with such technologies including video conferencing, internet use, and more. This treatment was effective in veterans by largely reducing symptoms of PTSD and depression for veterans diagnosed with combat-related PTSD. Having this form of telehealth delivered therapy also allowed for safe delivery of a more accessible program, showing the flexibility with this therapy. However, treatment non-completion rates were higher than average, though still in the acceptable range. These non-completion rates may have been due to the fact that since the therapy was not being delivered in person, it became harder for a patient to return to their normal functioning. Typically, patients are made uncomfortable around groups and waiting rooms earlier on in the treatment process, leading to a gradual overcoming of this discomfort around others. Though this is not possible with a telehealth delivered format, also, since some individuals are deciding not to follow up through these 90-minute sessions completed over the course of 18 to 15 weeks, this may be in part due to how the treatments are structured. As spaced prolonged exposure therapy, a subtype of prolonged exposure therapy, is structured to take place weekly rather than massed prolonged exposure therapy, which is structured to occur on a daily basis. The mass therapy length can create conflict with military obligations or civilians in everyday lifestyle. Instead of having weekly sessions, one could look into utilizing mass therapy, as it has been seen to be effective for treatments of agoraphobia, obsessive compulsive disorder, and panic disorder. A randomized clinical trial done in civilians also found that 1 week of daily cognitive therapy was equivalent to 3 months of weekly sessions. Thus, massed prolonged exposure therapy may be a better alternative to spaced prolonged exposure therapy, with spaced therapy being showcased in the first study, whereas the second study compares both forms of therapy. In addition to the previous studies, we found another study that looked at stress inoculation training, more specifically pre-deployment stress inoculation training, or PRESIT. PRESIT involves 3 training modules. First, educational materials are provided on combat and operational stress control. Then, individuals train in coping skills such as focused relaxation and breathing exercises. Lastly, the first 2 modules are practiced through exposure to video multimedia stressor environments, such as a 12-minute scripted scenario. In order to see if coping skills are working, heart rate is assessed. Within the specific study cluster randomized design, 350 Marines participated with 259 of them responding to surveys and pre- and post-deployment surveys being compared. Overall, it was seen that physiological arousal was reduced, showing the success of this treatment, especially as a potential preventative strategy within U.S. military to reduce the risk of having post-deployment PTSD. Although PRESIT was effective in military personnel, as they were provided training before their next deployment within this study, it is harder to use this subtype of stress inoculation training as a preventative measure for civilians, as one doesn't know if they will encounter a traumatic experience in the future, such as being a rape victim. That being said, this would be hard to use as a preventative measure altogether. Its modules can still be utilized to prevent PTSD-induced signs and symptoms within those who already have PTSD, thus still being an effective tool for therapy for civilians. There are many stories in the media and in movies that give different images of what PTSD is like and what happens when an individual experiences it. A well-known story that portrays an image of PTSD is the story of Chris Kyle. He is an Iraq veteran who served 4 tours, and his story is told through the movie American Sniper. In the movie, we notice that he begins to experience PTSD-like symptoms after his 2nd tour, but did not show full signs of PTSD until he returns back home and begins trying to revert back to a civilian lifestyle. Kyle demonstrates feelings of constant anxiety and the inability to relax. He's always feeling as though he is still in battle. He experiences different levels of flashbacks throughout the movie, which are often displayed in him reliving his time in Iraq through flashbacks to battles he was involved in. His wife constantly tries to talk to him about his experiences. However, he is very closed off and avoids opening up to her. His symptoms are exasperated in the film when his baby is crying and the nurse isn't helping his child. He became easily agitated and started getting violent. This happens again when he is at a barbecue and his child is playing with a dog, but he thinks that the dog is attacking his child, so he goes to attack the dog, but is stopped before anything bad happens. His symptoms were alleviated later in the film when he took on a mentorship role by working with injured veterans. This keeps him busy and prevents him from thinking about his past experiences and traumas. This also allows him to feel like he belongs again and helps him feel comfortable since he is working with other veterans. He is able to acknowledge his self-identification as a veteran, which gives him a sense of purpose. It is evident from the story and movie that Chris Kyle suffers a great deal from the trauma he experienced while in war. It is important to analyze movies and other stories found in the media to ensure that the portrayal of PTSD is correct, which is what we will do in the next slide. With many different portrayals of PTSD in the media, it's important to analyze the signs and symptoms presented by the media to see if they are accurate or inaccurate. As mentioned in the previous slide, the reason why Chris Kyle develops PTSD was from multiple experiences which all arose from his time serving in the Army in Iraq as a soldier. Over the course of his 4 tours, he was involved in a serious accident, lived in a war zone as a soldier, has experienced serious physical assault, and saw multiple people hurt and killed. Not only did he witness people being hurt and killed, but he has also killed multiple people himself, as his main role was a sniper. These are all possible causes of PTSD. Chris becomes very anxious and finds it hard to relax when he gets back from deployment, which is a common effect of PTSD, and the effects are harmful to the family. His wife has had a hard time getting him to open up about his feelings and having healthy communication with him. This is a common effect with partners of veterans that have PTSD, which affects the mental health of both parties. The film is accurate when it displays the strains of the relationship he has with others, as there is a lack of trust, as shown with his baby playing with the dog, and a lack of communication and closeness. Some common stereotypes of people with PTSD is that they are violent, dangerous, and also perceived as crazy. These labels are not a title which someone would want to have. So it could be easily a reason why someone would initially avoid therapy. The stigma of having mental illness and the acceptance of having PTSD on the victims could keep veterans away from therapy. Chris was able to soothe his symptoms by becoming a mentor to injured veterans. This prevented him from thinking about his own past traumatic experience, and it gave him a sense of belongingness. The stigma of having PTSD was reduced as he worked with peers who had similar experiences and symptoms like himself, which helped him heal. In conclusion, PTSD is a psychiatric disorder that can happen to anyone at any time. As seen through the signs and symptoms presented in our slides, and through the story of Chris Kyle, it can be very detrimental to one's health physically, mentally, and emotionally. People with PTSD tend to seclude themselves from people or situations that can trigger the traumatic event. They can also react negatively to normal loud sounds or accidental touches. PTSD can leave the people affected vulnerable and traumatized. They often have feelings of depression and anxiety that can affect their everyday life. People with PTSD may have trouble with their relationships with friends and family, and the symptoms may cause difficulty with communication, trust, or closeness. It is important for the person experiencing this disorder to have support from friends and family. They need to be able to access the therapies such as stress inoculation training, cognitive processing therapy, and prolonged exposure. This disorder is a serious disorder that can alter the individual's life, but with positivity and proper treatment, they can continue to live a happy and successful life. The following slides are showing the references used to retrieve the information in our presentation. Thank you for listening.